Welcome back to Medicare Unscripted. I'm Kaylee Terbovich, Director of Medicare Operations at Secure Money Health. On this podcast, I break down real Medicare situations, common mistakes, and what you actually need to understand so you can make confident decisions about your healthcare coverage. Because when it comes to Medicare, it's not always about what you sign up for, it's about what quietly changes after you enroll. And that's where a lot of people get caught off guard. So let's get into it. Let's start with a real life scenario to put this into perspective. You sign up for a streaming service. It's $9.99 a month. No big deal. You use it, you enjoy it, you don't think too much about it. But fast forward a year, now it's $19.99 a month. You didn't notice the email, you didn't review the changes, it just kept renewing. Now you're paying double. That situation, that's exactly how Part D prescription drug plans work. They automatically renew every year. But here's what most people don't realize. The plan you had last year is not the same plan you have this year. So every year plans change. Premiums, deductibles, drug coverage, pharmacy networks. And if you're not reviewing it, you could be paying more or losing coverage without even realizing it. So let's break down what that actually means when it comes to your prescription drug coverage. Let's start with drug tiers, because this is where cost really comes into play. Drug tiers are how your plan categorizes medications. Most Medicare Part D plans have 5 tiers, but it can vary. Lower tiers, usually Tier 1 and Tier 2, are your generics or your preferred generics. These are your lowest cost medications. Now, middle tiers, like Tier 3, those are considered to be the preferred brand. These come with typically higher copays. And then, Tiers 4 and 5, those are your non-preferred brand and your specialty medications. That's where you'll see the highest out-of-pocket costs. So even if your medication is covered, how it's classified determines what you're going to pay. So let's dive into this a little bit further. If you're on a higher tier medication, everything builds towards one number, $2,100. This is the amount you and the plan spend on prescriptions before you move into what is called the catastrophic coverage phase. Once you reach this phase, you will pay little to nothing for your drugs for the rest of the year. Now, let's talk about another change that's becoming more important, the prescription payment plan option. This allows you to spread your drug costs out over time instead of paying large amounts all at once. So for some people, this can make a really big difference in managing monthly expenses. Now, let's talk about pharmacies. Not all pharmacies are treated equally under your plan. You have your preferred pharmacies and your standard pharmacies. Your preferred pharmacies have negotiated lower costs. So if you fill your prescription there, you'll typically pay less. Your standard pharmacies, on the other hand, are still in network, but you'll usually pay a little bit more for that prescription. So here's the key takeaway. Same medication, same plan, different pharmacy, different costs. And what most people don't realize is just that. Finally, one of the most important documents you'll receive each year is called the Annual Notice of Change. This outlines everything that's changing in your plan for the upcoming year. Most people get it and don't read it. But that document tells you exactly what is about to change for the following year. So this is where a lot of misconceptions come in. So let's do a little game of myth or mistake. Here is the quote. I can keep the same Part D plan forever. That is a mistake. Plans change every single year. Even if the name stays the same, the details inside that plan can shift. And those changes can directly impact things like what your medication costs are, whether they're covered, and where you can fill them at. So now let's talk about why this matters even more today. We're seeing some really big shifts in how prescription drug coverage works. First, the drug cost cap structure is evolving. There is now a limit on what you will pay out of pocket each year for prescriptions. That was the $2,100 that I was referring to earlier. That's a major step towards financial protection. Second, we're seeing more payment smoothing options. Instead of large, unpredictable pharmacy bills, you may have the option to spread those costs out over the year. It makes budgeting much easier. And third, we're seeing ongoing formulary changes. Plans are adjusting, such as which drugs they cover, how those drugs are tiered, and what restrictions apply. So even if your medication was covered last year, there is no guarantee that it will be covered the same way this year. The system is becoming more consumer friendly, but only if you stay informed. And this ties in directly to a question I get all the time. It's, my drug wasn't covered this year, but it was last. Why? And the answer is simple. Formularies are updated every single year. Plans renegotiate costs, they adjust coverage, and they reclassify medications. So your drug may still be available, but it might move to a higher tier, require prior authorization, or not be covered at all under that specific plan. And that's why reviewing your plan annually is so important. So what's the takeaway here? Let's go back to that subscription example. The issue wasn't the price increase, the issue was not reviewing it. And that's what happens with Part D plans. People let them auto-renew without checking what has actually changed. So here's the preventable problem for this week: not reviewing your prescription drug plan during the annual enrollment period. Every fall, you should be asking, are my prescriptions still covered? What tier are they in? What will they cost me? And is my pharmacy still preferred? Because a small change in your plan can turn into a big increase in your costs. And that's why this matters. We know Medicare can feel complicated, but it does not have to be confusing. Until next time, stay safe, stay informed, and I will see you next time on Medicare Unscripted.